This is part 2 of fractures of the forearm, wrist and hand. Here we know new types of fractures of the forearm. One of the most common fractures of the forearm is the fracture of distal shaft of both bones, radius and ulna, as we see in this X-ray views. There is a displaced fracture of distal shaft of both bones, radius and ulna, as here also we see a common fracture of distal shaft of both bones, radius and ulna, in the early childhood with severe angulation. In the left view, X-ray view, we see angulated and dislocated radius and angulated but not displaced ulna. In the second view, on the right side, we see the condition after closed reduction and callus formation in a correct axis. Another type of fractures of the forearm is the Monteggia fracture. It is a complicated fracture affecting both bones of the forearm, the radius and the ulna, as we see in this X-ray view. As in this case, the Monteggia fracture is a fracture affecting the ulnar shaft with dislocation of the radial head at the proximal end of the forearm near the elbow joint, either forward or backward dislocation of the radial head. The forward type of the dislocation of the radial head is more common. Closed reduction by flexion and supination of the forearm, or it needs sometimes an open reduction and internal fixation by intermedullary nailing, as we will see later on. The backward type of the Monteggia fracture is as in the second figure below. So the radial head is displaced downwards. The backward type, we need closed reduction by extending the arm, or we need sometimes open reduction and internal fixation according to the severity of the case. Another example of the Monteggia fracture, a comminuted fracture, we see here the direction of the dislocation of radial head and the displacement of the proximal fragment of the ulnar fracture. The X-ray view after trauma and before treatment. It's a complicated case, a comminuted fracture. Another case of Monteggia fracture, condition after an open reduction and internal fixation by a plate and screws of the ulna, and by reduction of the dislocated head of radius. So it is an internal fixation and open reduction. Another type of fractures of the forearm is the Galeazzi fracture. It is a fracture of the radius and dislocation of the distal end of the ulna. The ulnar end is displaced posteriorly, and it is not seen in children. We see here the open reduction and internal fixation of the Galeazzi fracture. The X-ray view of a typical Galeazzi fracture condition after open reduction and internal fixation of the radial fracture by a plate and screw, and the reduction of the ulnar head. Maybe the most common fracture of forearm in elderly and in adult age is the Colles fracture. It is a fracture of lower radius and posterior displacement of the distal fragment. It is first described in 1814 by Abraham Colles. It occurs more in elderly age, relevant to incidence to osteoporosis. It's a typical osteoporotic fracture. And as you see here, in this case, there is typical clinical picture, what we call dinner fork deformity. Dinner fork deformity. The distal fragment of the radius is displaced posteriorly, tendency to supination of the hand. It's a typical deformity by Colles fracture. And here the mechanism of the fracture, the Colles fracture, is demonstrated. Fall on the outstretched hand, displaced of the distal fragment to the posterior and radial directions, as here in this illustration. And here also another example of Colles fracture, typical anterior, posterior and lateral X-ray views with posterior displacement of the distal fragment of the radius. The treatment of the Colles fracture is mostly conservative, a classical below elbow plaster of Paris, POP, to immobilize a Colles fracture from the metacarpal heads to just below the elbow with ulnar deviation for 6 weeks. A similar fracture like the Colles fracture is the Smith fracture, fall trauma on the flexed hand, extended elbow, fracture dislocation of the distal part of radius, volar displacement of the distal fragment of the radius. Principles of reduction of Smith fracture: general anesthesia to obtain maximal grade of relaxation of the patient, manual reduction by an expert. It should be gentle and correct. Axial traction of fingers, anatomic reduction and control by X-ray view. So now we finished the part 2 of types of fractures of the forearm. Next time we will know the fractures of the hand and wrist.